Probably the most critical piece to make farm and hospital work within an institution has been able to get the client to understand why we want to do it. The biggest piece that they look at is that they have a team of accountants, and they look at numbers and they look at numbers again, and they try to figure out how they're going to get everything to meet so budgets are met, because hospitals generally run as nonprofits, so they aren't making a whole lot of money either. They reinvest almost everything back into the properties. So contrary to popular belief, hospitalists and doctors make a good paycheck, but hospitals do not make a good paycheck. So what we're looking at is we're trying to determine how we can get the client to really buy into an elevated cost and why. So being able to go up and talk to them and talk to our president and vice presidents, whether it be here at Kalispell Regional or down at Providence at St. Pat's in Missoula, or you can go to any of the hospitals within the Seattle, California market, pick one. What it means is that you have to be able to go up and talk to them and tell them this is the process, this is why we want to do it, and it mainly revolves around being able to, one, serve quality product, and two, being able to liberalize the diet for those that otherwise would have such horrific constraints that they're going to eat it while they're here because they're hungry and they have to, but as soon as they leave, they aren't going to follow the plan. So we try to show them that they can have healthful foods at home without having something that is labeled diet. And that was the biggest piece that was hard. And so getting administration buy-in and trying to get somebody that is an accountant to understand why you want to spend more money and still serve lettuce. The education piece and where food comes from and why is paramount to the success of the program. If we have the ability to make sure that our client is aware of what they're having and why, then they're going to hopefully take that information, as long as, well, there's one key element to that. You got to do it right. So if you go to a restaurant and you have a bad meal, 10 people are going to know you had a bad meal. You go to a restaurant and have a great meal, one person is going to know that you had a great meal. That's the level of communication that we share. And it's no different here. So we have to educate, educate, educate. So the more we get a chance to go up into a client's room, when I hear somebody had a poor meal or a bad or a dissatisfying opportunity, I'll go up, and it gives me, one, an opportunity to understand why, and two, talk to them about the local products that we're using, why we're putting it in there, so hopefully that we can elevate, the flavor concept of the meal. Same thing when it comes down to, say, Paint the Flathead Pink Month, which has to do with breast cancer. So I saw an opportunity to do some cooking classes, which then in turn got some patients in to teach them how to cook with less sodium and use citruses in place, and also use roasting techniques to elevate flavors without adding sodiums, because when you're in chemo, sodium's a big deal, really throws your flavor palette off, makes things taste horrible. So I had an opportunity to teach some classes, not only utilize some cooking techniques, but also talk about the products, why we buy them, and what we're using them for, as well as using that within our cafes, go to tables, talk to the guests, make sure that they know what we're doing and why. So it's all about education and advertising a little bit, but mainly education from our mouths going up to our clients and talking to them and making sure they understand why.